Now, first of all, let's speak about educational cooperation. Now, Carlos Laje announced in 1997 that up to that date, over 1,000 Caribbean nationals had been trained in Cuba and that they were granting a further about 250 scholarships for 97-98. Now, the pace and number of such awards have increased exponentially during the last decade. Now there is an average of 1,300 Caribbean students per year located in Cuba. The largest number of scholarships is given for medical training, but there are many other technical areas of training provided, including agriculture, architecture, and engineering. A national breakdown of students indicates in 2008, Belize had 171 students there. In 2007, Barbados had 12 medical students in Cuba, but 29 previously graduated. Jamaica this year has approximately 400 students in Cuba. Guyana, 2007, had 200 students. St. Lucia, 2005, had 69 medical students. Antigua, 43. Haiti, in 2005, had 676 students overall. And the Dominican Republic, in 2005, had over 400 students in Cuba. Now, the source comes primarily, well, that comes from a report from the Cuban Ministry of Foreign Affairs. Now, a new development in Cuba's educational cooperation with the Caribbean has been the offer to provide training in Caribbean countries themselves. In 2002, Cuba offered to set up a facility and provide the staff to train up to 200 health professionals specializing in the treatment of HIV and AIDS. It was mentioned that the location would probably be an OECS country. Now, in 2006, a nursing school started in Dominica, and currently there are 127 students being trained by 17 Cuban instructors. These are not all in HIV nursing. Cuba also has a program in Cuba where right now there are 353 nursing students from 6 Caribbean countries enrolled studying the specialized nursing of HIV patients. Now, in terms of cooperation in health, more generally, since the 1990s, Caribbean countries have experienced, as you know very well, have experienced a steady exodus of health professionals, generally to metropolitan countries, attracted by better pay and working conditions. In 2004, it was noted that Jamaica loses 8% of its registered nurses annually and more than 20% of its specialist nurses. The shortage has increased with the recent expansion of free health services in public hospitals. In March of this year, it was announced that Jamaica has a shortfall of over 1,500 health workers in public facilities. A similarly acute shortfall exists in Guyana and, to a slightly lesser extent, in Trinidad and other Caribbean countries. And the scarcity of health personnel is particularly marked in rural areas. Much of this shortfall in the health labor market has been filled by government-to-government contracts between Cuba and Caribbean governments. It was reported in 2005 at the second CARICOM Cuba summit that over 1,000 Cuban health and other professionals were working in the Caribbean. In 2006, there were 114 Cuban doctors serving in Belize. 2003, Trinidad received 80 medical personnel on 2-year contracts. Trinidad has not participated heavily in this. 91 new Cuban health workers came to Jamaica this year. They added to the 67 already here. Don't quote me on those figures. They might be somewhat, they might need updating. Guyana has 122 Cuban health professionals. Antigua has a team of 44, while since 1998, over 2,500 have been assigned to Haiti at various times. Yeah. The Cuban government states that its technical cooperation in health in the Caribbean concentrates on strengthening the public health infrastructure and on serving remote regions. There are 4 main programs. There is a program on HIV, in HIV/AIDS treatment and training. There is the Comprehensive Health Program, which serves several Latin American countries and which also benefits Belize, Suriname, and Guyana. There is the Eye Treatment Program, now known as Operación Milagro, which is supported by Venezuela, subsidized by Venezuela, and ALBA. Now, this provides ophthalmological screening, treatment, and surgery for reversible eye complaints in the home country or in Cuba. And since 2005, 7 Caribbean countries have participated in this program, and almost 10,000 people have been treated. In Jamaica, between 2005 and 2008, 30,000 people were screened, and 4,500 were operated on, had eye operations. There is a new program of comprehensive diagnostic centers, which began in 2004. These centers are set up in various countries with equipment donated by Cuba, and they offer a range of medical services. Antigua has 1, Guyana has 4, St. Vincent has 1, Haiti has 10. So these are the types of programs that have been engaged in. Now, my conclusions. This is certainly a very impressive record of South-South cooperation, which has contributed very significantly to human development and to building human capital in the recipient countries. It has made a significant impression on communities, on the people of Caribbean countries. And it has also served to indicate, well, it has made more people aware of what are some of the tasks that the state should be doing in a time of tightened resources and in an era of globalization when many of our scarce health resources are not here to start with. It shows what can be possible in the area of human development. And it has been a very productive partnership between Cuba and Caribbean governments. It has provided an image of an alternative, however that alternative comes about, an alternative to the present model of state activity. It has contributed to greater integration and more people-to-people ties between Cubans and other Caribbean nationals. I happen to know of quite a few marriages in some of the OECS countries. Better understanding of each other's environments and of each other's societies.